All over the world, clinicians are noticing an increasingly common phenomenon. Young people stuck and not progressing at the transition between dependent adolescence and independent adulthood. There are various names for it. Failure to launch is perhaps the most common name in the West, though I prefer to call it delayed transition to adulthood because it truly is a delay, not a final failure. Related terms include NEET in the United Kingdom, which stands for Not in Education, Employment, or Training, and hikikomori in Japan. These individuals have aged out of adolescence but are continuing to live a life that requires more support from parents and others than their actual abilities make necessary. Most of them are male, though young women also experience this. Most are unemployed or underemployed, isolated, socially anxious, fearful of failure, and with very little sense of direction or goal in life. They tend to spend most or all of their time at home, sometimes in a single room. And even at home, they tend to adopt a passive, receptive role. Clinicians come into contact with situations like this either when the young adult seeks therapy, often at the urging of parents, or when the parents themselves attend therapy in alarm at what's happening in the family. But when they come to see you, what do you do? I'm Randy Patterson, author of How to Be Miserable in Your 20s, and I've been helping individuals and families like this for over 20 years. I've helped clinicians build out their skills in working with this problem, and now for Praxis Continuing Education and Training, I have a 5-session, 10-hour course called Failure to Launch, helping young adults and their parents navigate the road to independence. We'll talk about the nature of the problem, the factors that lead young people to retreat inward, and for the process of independence to stall or go into reverse. We'll consider the factors that seem to contribute to the problem becoming more and more common. We'll look at how to build an alliance with a young adult who may only be in your office to pacify their alarmed parents and to maintain the status quo just as it is. We'll look at how to help the young adult chart their own path forward, building an adulthood that they want. And we'll talk about the various components of therapy that can be brought to bear, including behavioral activation, exposure therapy, skill building, and cognitive reorientation to the realities of adult life. But we'll also consider how to help parents and families work with this situation. The defining feature of the problem is that one person is receiving more care and support than their resources might require, and someone else is providing that care and support. By the time anyone arrives in our offices, parents are often fed up. But rather than helping them cut off their support and dump their young adult into deep water, we'll work with them to shift their support from support for dependence to support for independence, reworking the way the family actually functions. We'll look at how to involve parents in the young adults therapy, but also how to proceed when parents themselves are your identified clients. We'll look at how family systems can contribute to the problem and provide some tips to prevent difficulties like these from occurring in the first place. If you see people dealing with this problem, either the young person himself or herself or their family members, I think this course will provide you with clear ideas about how to proceed more efficiently and more effectively. Young adults in this situation and their families are suffering. Increasing their capacity for managing themselves and the world provides a better life for everyone involved. In this course, you'll learn strategies to help, and you'll receive a set of resources that you can use with clients. Join me with Praxis CET for this 10-hour program. Thanks for listening.